Hello, everybody. We will just give folks a few minutes to join, and we will begin momentarily. Thank you, everybody, for joining. We will start with a few housekeeping items. So just a reminder, if you have any questions, we do ask that you locate that Q&A icon in your menu bar and you place any of your questions there. We will try our best to answer them live. We will answer some in the box as well. And at the end, we will have a brief survey that you also can select if you want to hear back from us. So we encourage you to take that survey at the end of the presentation, and you can note if you have any unanswered questions, we are happy to follow up with you. So thank you for joining us today for ECDS Explained Key Insights and Common Questions. I'm your host, Anna Bentler. I am the Assistant Vice President for our Quality Informatics team. And our main presenter is Fern M, our Director for our Quality Informatics team here at NCQA. The agenda for today, we're going to give you some background and tell you all about ECDS. We're going to touch base on the ECDS transition updates, what you have to look forward to. We will review measure use and adoption. We will highlight some of those frequently asked questions, and then we will have time for open Q&A that, again, we will leverage the Q&A icon to receive your questions. One of our most common questions, I will just note right away, is we will be sending the slides out after the presentation. So you can watch for that in your inbox. And to get started, we're going to start off with a polling question. So we want to hear from you. How familiar are you with the HEDIS ECDS reporting method? So I'll just give everyone a little bit to answer that. It looks like a lot of people are responding. Thank you. So it looks like we have a wide range of experience with the ECDS reporting method, a lot of some experience, and we hope to elaborate and expand your knowledge and being familiar with the ECDS reporting method throughout this webinar. So Fern, I'm going to hand it over to you to jump into the background of ECDS.
Great, thanks, Anna. Again, my name is Fern M, Director of Quality Informatics here at NCQA, and I'm very excited to have you all here with us today for us to dive into some common questions, go over the ECDS reporting method, and also hear more from you all today as we go through this transition. And so we're very encouraged by all the enthusiasm and interest in this webinar and topic. So first, we wanted to start with providing definitions for two key terms, ECDS and DQM. So these terms are related, but not synonymous. So they're not the same. And so we often, this is one of the key questions we get is, what's the difference between ECDS and DQMs? So ECDS refers to a HEDIS reporting method. It's specifically referring to a set of guidelines and standards that provides a structured way to aggregate electronic data for HEDIS reports. And so we have a set of measures that are specified for ECDS reporting that we're going to get into. DQMs, that stands for Digital Quality Measures. That's a standard interoperable format, and DQMs are computer interpretable, fully specified standard-based measure content based on FHIR CQL. And DQMs improve the delivery and utility of measure specifications, making it easier to use measure content. And so we have ECDS and traditional measures that are both available as digital content through NCQA's digital content services. So NCQA is currently going through a multi-phase digital transformation, and the ECDS method in the transition is a key part of that transformation. We'll be focusing on the ECDS method in today's presentation, but we do encourage you to visit the Digital Quality Hub, where you can learn more about the overall digital quality transformation work and the different phases of that work. So as I noted, a key part of this transformation is pushing us towards the future of HEDIS, which leverages more electronic health data, more electronic data in general. And so we're evolving beyond centering only claims data and more retrospective methods of assessing quality to now focusing on how we can better leverage more electronic data and enable the advancement of measures that focus on health outcomes, or more measures that can focus on health outcomes. And the ECDS method, which, as if I didn't note, stands for Electronic Clinical Data Systems Reporting Method, was introduced as a way to help reimagine how data sources can be used for quality measurement through encouraging the more efficient use and exchange of electronic data sources, such as EHR data, HIE and registry data, and case management data, alongside administrative claims data. So a few of the key objectives or core principles of the ECDS method are leveraging more data to get to better or greater insights of care through allowing any data source or any relevant and valid data source to be used for the measure calculation. Also aligning with interoperability standards. So requiring that data be stored in structured electronic formats that can use standard layouts. So really promoting the use of clinical terminologies such as LOINC or SNOMED codes, for example, which are being incorporated in our measures. And also enabling the bidirectional exchange of information. So requiring that there's a two-way stream of information sharing where data used for reporting is also made available to the patient, as well as the patient's care team as well, to support care coordination. So I know many of you have probably been on this journey with us as we've introduced the ECDS method and expanded the measures in this domain over time. But we just wanted to provide some background. As I saw, some are new to the ECDS method, while others are experienced, and some have some experience. So we just wanted to provide some of that history of how we got to where we are today. So over 7 years ago, we actually were developing new measures addressing depression care. So looking at depression screening and follow-up, remission and response, also assessing monitoring depression symptoms, so really looking at clinical outcomes for depression. And through testing and development of these concepts, we learned quickly that we were going to need to leverage clinical data to comprehensively measure quality in that space. And so we introduced those measures, and through that, we introduced the ECDS reporting method, which enabled us to really measure, assess these more patient-specific metrics, and bring in more of that real-time data that can really drive improvements in care. And since then, we've been introducing many different measure concepts, ranging from unhealthy alcohol use screening and follow-up, prenatal and postpartum care. We've expanded our scope of immunization measures, as well as recently including a new measure for social needs screening and intervention. And most recently, we've started to transition existing traditional measures. So traditional is referring to the administrative and the hybrid reporting methods, transitioning those measures over to the ECDS framework. And so this was to really give organizations an opportunity to get experience with ECDS with measures that they're familiar with, as well as enabling our overall transition over to ECDS. So currently we have 19 HEDIS measures in total that are specified for the ECDS method. And you'll hear a little bit later as we're continuing to expand the measures in this domain. And here you have the 19 measures that are currently specified for the ECDS method as of measurement year 2025. We'll talk a little bit about what's coming next. But as you see, we've actually bucketed these measures into two categories. One is measures that were developed for the ECDS method. So we have 12 measures that we introduced them originally following the ECDS standards. And then we also have a category of measures, 7 measures, as I mentioned, that have actually transitioned from the traditional method. So the administrative method and the hybrid method, we've actually already have transitioned these 7 measures from those original reporting standards to the ECDS method. And you can see through this list of measures that this domain now includes a range of different content areas, populations, and domains of care. So one of the questions that we often get is, particularly as we transition measures from the traditional methods over to the ECDS method, is what is the difference? What are the differences between the reporting methods? And so we did want to spend a little time really talking through some of those differences, and also call out places where there are no differences, because there are also some consistency and some things that have not changed between those reporting methods. First, we want to start with the data sources themselves. So here listed on the slide are the 3 reporting methods, the administrative method, the hybrid method, and of course the ECDS method. The administrative method uses administrative data and supplemental data, which is really any data source that is not administrative sources. And administrative sources could include enrollment, claims, and encounter data. The hybrid method also includes administrative data, supplemental data, and then also medical record review and for a sample of members. And then the ECDS method also includes administrative data, but it also includes EHR, HIE, registries, and case management data. So I want to note that although these lists vary across the methods, the underlying data sources themselves may not actually be different. And so these lists are representing the reporting designations for HEDIS reporting, the guidelines for how data is included in reporting may differ based on these designations and based on these reporting methods in these guidelines and these standards. So for example, supplemental data that's used in the traditional methods, that's really just any data source that is not administrative data. So those designations next to ECDS, EHR, HIE registry, case management, those are just examples of supplemental data sources that could be pulled in for those other sources as well. It's just not labeled as such for ECDS reporting. Also, information pulled from a medical record review, the medical record review process can still be incorporated for administrative and ECDS reporting. So the point is, going from one method to another may not actually change the sources that are used, just the ways that they're incorporated into reporting and the ways in which the measure is calculated. I'm going to get into some of those differences on the next slide. So this slide is a table that's showing some of the differences between the ECDS and the traditional methods. And so I'll start off with the population. The hybrid method is calculated based on a systematic sample of members, a sample of 411 members, for example, out of the entire membership. So it's a sample of members, while the administrative and ECDS methods are calculated based on the full member population. So there's a difference between the administrative and ECDS methods when compared to the hybrid method in the terms of the measure calculation and the population used for that calculation. We also often get the question, can administrative claims data be used? That's actually a place where there isn't a difference across the measures, across the reporting methods. Administrative data can be used for all three reporting methods, including ECDS. And so we just wanted to make that clarification. We do, often get that question. Next, another difference is what we want to point out is where clinical data can be used in the measure. So this is a difference. For traditional methods, administrative and hybrid methods, plans use administrative data, and they could supplement their numerator and their required exclusion information from other non-administrative sources. So they could supplement that information with supplemental data, but they cannot do that for the denominator. So the denominator can only include administrative data. There's a few exceptions, but for the most part, you can only include administrative data to calculate your denominator for the traditional methods. For ECDS, non-administrative data, that's defined as EHR, HIE registry data, case management data, all those sources, as well as claims data, can be used to define your denominator population. And so that's really to be able to get to one of those core principles, to be able to leverage more data to get greater insight of care for the target population. And just lastly, I wanted to close with, for this slide, with some of the considerations as we think about the different reporting methods. The administrative method, that data is routinely collected and readily available, but it can have limited clinical detail rather, to get to some of those outcomes that we may want to get, or get to more specific populations that we may want to measure. The hybrid method does enable tailoring to non-standard local health environments, but we know it could be resource intensive. The medical record review process could be resource intensive, as well as that information is very retrospective and could be less actionable in real time. The ECDS method is really encouraging the capture of clinical information in a more efficient way, as well as to leverage information that could be used in real-time care. And so it can be more prospective and more actionable as one of the goals. But we know that health plan capabilities and organizations' capabilities to leverage those sources in a standardized way can vary. So that could be a challenge, right, of some of these measure concepts. So we just summarized some of the differences and similarities across the reporting methods. And we just wanted to really summarize, as our goal is to expand the ECDS framework across HEDIS in alignment with our digital strategy, some of our focus areas as we are proceeding to do that. One, we're continuing to support the existing reported ECDS reported measures in those transitions. So supporting the adoption of those measures, supporting the use in various programs and uptake in programs, as well as public reporting. We're also focusing on ECDS transitions, particularly the hybrid transition. And we'll actually spend a lot of time today talking about the hybrid transition. And that's really to better streamline the data management processes, reduce some of the burden associated with relying on manual record review, as well as meeting our goal of transitioning to digital measures. We're also going to be focusing on our strategic engagement and standards. So how can we align with how standards are evolving, as well as the availability of clinical data across these concepts? And that has been helpful. And we've used that and we'll continue to use that as we inform the implementation of new measure concepts of the various transitions that are taking place. So now that we've talked about the background of ECDS, as well as some of the differences between this reporting method as opposed to the traditional methods, we want to focus now on talking about the transitions. So as you know, we have been transitioning our existing measures and expanding the ECDS framework across HEDIS. And we want to just share some of that work with you today and some of the ways in which we're moving forward with those plans. So we wanted to first indicate that we do have experience with these measure transitions. As noted before, we've already converted some measures from the traditional methods over to the ECDS method. And we've been doing this over the last few years. I'm sure many of you might be very familiar with these measures that are here on the screen. And the first three on the screen are actually were administrative measures. The last four are hybrid. So both sets of measures we've had experience with converting them over. And this was, again, to give plans that ability to have that experience. We also gained a lot of insight from this ability to, we actually gave plans the ability to report these both ways in the same measurement year, which helped us understand where there may be differences and where there actually are some similarities, as well as the impact of moving from the traditional methods to leveraging the ECDS method. And we've applied those learnings and we've applied those insights to our strategy moving forward. And so from those learnings, we have outlined a few key considerations when thinking about and preparing for the transition to ECDS reporting for these traditional measures, for the HEDIS measure set. And so this slide is showing those key considerations, emphasizing the shifts from the administrative method to ECDS and the hybrid method to ECDS. So first, for measures that are transitioning from the administrative method to the ECDS method, we know that the reliance on, we have seen that many plans typically use the same data sources as noted previously. That's administrative and supplemental data. But if they're using a range of different sources, they're typically able to incorporate those sources for ECDS reporting. And so the reliance on those same data sources really indicates and ensures that there'll be minimal disruption with transitioning the administrative measures over to the ECDS method. And we've seen that from talking to us, those have reported and had experience, but also looking at the data. has also indicated that there wouldn't be much difference and much impact, even with the differences that I outlined from going from administrative to ECDS. In contrast, the traditional hybrid measures, the hybrid measures moving to ECDS might be more complex. We know some plans may rely heavily on clinical data pulled from the charts, while others may not. So it depends on the measure and the concept, measure concept. Some hybrid measures still are pretty reliant on claims data. But ECDS measures differ by including the entire qualifying population without sampling. And clinical data from medical records must be standardized in electronic formats to be included for reporting and for ECDS. And so a primary challenge really lies in the availability and the standardization of electronic clinical data, with the goal of being able to transition smoothly in a way that supports accurate and comprehensive reporting for all eligible members in the plan's population. So for that reason, we have really focused on outlining a very strategic strategy and a timeline from moving away from the hybrid method that can support our digital transition goals, but also support organizations in their overall transitions as well. So this visual is showing the considerations, the steps that are involved when transitioning a hybrid measure to the ECDS method. And so this is really many of the things we consider when outlining the timeline that I'll be showing you in the next slide, when outlining the timeline for each of the remaining hybrid measures on when we're going to remove, or we're planning to remove the hybrid method from those concepts. So first, we assess whether we looked at the data, the analysis. So there's the HEDIS reporting analysis. We assess what the impact is or the reliance on the medical record review proportion of the measure calculation, which is called the hybrid lift. So how much of that reporting is of that performance of that across the different reporting entities is using the medical record review. And so that gives some insight to, by removing the hybrid method, what could we see? What would be the impact? And so we assess that, but we also will continue to assess that along the way. We also looked at and considered the dual reporting, and dual reporting is really looking at reporting using both methods, the traditional method and the ECDS method at the same time in the same measurement year, but just literally looking at what we see in performance through testing, also reporting, and using that as a way to also indicate feasibility of transitioning the measures. We also consider the potential impact on public reporting, on payment incentive programs, benchmarking, as well as just really understanding this impact as well, and engaging with stakeholders that use and leverage these measures in various programs to make sure we're maintaining that transparency and maintaining consistency and trust as we move through this transition. We're also working to align with our broader digital transition strategy, which aims to better streamline data collection and improve accuracy and timeliness of quality measures. So how can we also build a timeline that supports our digital transition goals as well? And finally, as noted previously, we are considering the standards and working very closely in the standards community to understand those opportunities to close some gaps where there are gaps in data and feasibility or standards, but also understand the availability of electronic clinical data to help inform our approach. And so that will also be something we look very closely across these measures as well. And so all of these factors really made it very clear that we should proceed with a very strategic path for sunsetting hybrid. So here is actually the timeline. So you may have seen this. We did share this timeline for the first time at the end of last year. So this is our planned timeline to remove the hybrid method from the remaining hybrid measures in HEDIS. So currently, so as of measurement year 2025, there are 8 measures that still have that maintain the hybrid method. And so we've set a goal by measurement year 2029 to remove the hybrid method from these measures. And so you can see that each of these measures there are different timelines. It's not just 1 year. We're actually going to be doing it over time through this time frame. But in addition to that, the measures have their own pathways. So not only are they on different timelines based on the considerations we just talked about on the previous slide, but they have different pathways to removing hybrid. And so that the dark blue dot represents when hybrid would be removed. And then we also have indicated where we have noted the plan to introduce the ECDS version of the measure. So for some measures, so some of the hybrid measures, we're going to move directly to ECDS or revert to the administrative-only method. Other measures, excuse me, other measures will transition as a ECDS or new ECDS measure. And what that means is we're going to introduce, and this is really the 5 measures at the bottom, the 5 last measures. We're going to introduce the ECDS version first, and then we're going to remove the hybrid version after a transition period. So there will be a period of time where the ECDS version, well, first we're going to test and invalidate that new ECDS version of the measure, introduce it into HEDIS. There'll be a period of time when both measures will be in HEDIS. And then we will retire or remove the hybrid version of the measure after a transition period. And so through this process, we're going to continue involving stakeholders, using public comment as we recently did, to announce these changes, provide early notice, get input as we continue to change these measures and remove the hybrid method. We did share some updates for measurement year 2026 in the most recent public comment. And I'm actually going to share some of those in a few slides. Kind of focusing on those last 5 measures that I called out in the previous slide, where we're going to have that transition period, we're replacing these measures with a new ECDS measure after a transition period. And that's really to ensure that seamless transition. So what this visual is showing that there will be a time, the different phases of that. So we'll first develop and test the new measure and conduct some parallel testing of the new and old. Then we'll implement the new measure, the ECDS version of the measure. And after we're done the transition period, we would sunset the hybrid measure. And during that period, we will continue to evaluate the HEDIS reporting data. We will provide anticipatory guidance around benchmarks, as well as continue to identify and close digital feasibility gaps through our engagement with our stakeholders, as well as engaging with standards. And so this phased approach, again, really ensures that we can maintain the integrity and reporting accuracy throughout that transition. So as I noted, we did just announce or share some updates related to ECDS in the most recent public comment, which was for measurement year 2026, which is scheduled to be released this year, August of this year, 2025. And so we want to just share some of those updates that were in the public comment. If you you may not have had a chance to participate in public comment. So we actually have, we announced some new measures that are going to be, that we're proposing or we are going to be introducing for measurement year 2026, again, being released later this year. So we have two new measures, the tobacco use screening and cessation intervention measure, and the follow-up after acute care visits for asthma measure. We also are planning to introduce the ECDS version of the blood pressure control for patients with diabetes measure. This is one of the hybrid measures that we presented in one of the previous slides, the table that is going through a transition. And so this is that first step where we're going to introduce the ECDS version in this upcoming measurement year, eventually getting, it will replace the hybrid version after that transition period and evaluation period. We also announced in the public comment that we'll have some measures that are transitioning over to ECDS method. So traditional measures that are in HEDIS that we are planning to convert to the ECDS method. So the lead screening in children measure, which is a hybrid measure, will be transitioning directly to the ECDS method in this year. This upcoming measurement year, we're proposing for that to be transitioned in 2026. And then we're also going to be converting the statin therapy, the two statin therapy measures, which are actually administrative measures. We're going to be converting those to the ECDS only method as well for measurement year 2026. So we're really planning, again, as you see, to use these transitions and continue to identify those opportunities to convert our new measures concepts under this ECDS framework to really reach our goal and ultimately our overall vision for digital measurement. So we talked about the different transitions, the ECDS measures or traditional measures that have been transitioning over to the ECDS method. Now we just want to spend a little time to highlight some ways in which these measures are currently being used. So first, in NCQA, we use measurement, transparency, accountability to highlight top performers and drive improvements in care. And we do that through our own quality programs. So we actually have 15 ECDS measures that are now publicly reported and available in Quality Compass, which provides reliable health plan performance data and benchmarks. So very excited to now have, over time, really expand the number of measures that are available in this program. We also provide accreditation for health plans and systems and also highlight performance through programs like our health plan ratings program, which is based on HEDIS quality measure results. And there are some ECDS measures that are included in health plan ratings. You can actually visit the ECDS webpage. We've updated the webpage, but also the FAQs, and you can actually get that list of measures that are currently in health plan ratings today. That list of ECDS measures that are currently in health plan ratings today. We also have our ECDS measures used in different external programs. This is just listing some of those programs that we've been working very closely with our external stakeholders to adopt those measures in those programs, as well as enable that transition from the previous traditional methods over to the ECDS method to support the continued use in these programs as well. So now I'm going to spend a little time. One of the questions we did get is, how do we support ECDS reporting? And so we just want to spend a little time talking about some of those efforts that can be implemented or considered when supporting or seeking improvement for ECDS reporting. So when we talk about the ECDS method, it really isn't the ECDS method itself that is challenging, right? It really depends on the measure concept, and really the strategies around improvement really revolve around being able to leverage electronic data. And so there's really two different areas. There's improving standardization of data. There's increasing exchange of electronic data as well. So starting with improving data standardization. So this is really getting to consistent and reliable data at the source. And so to really facilitate usability of data for quality measurement, but also for quality improvement, data should be using standard terminologies and codes, or be in a structured format that it can efficiently map to those various codes and code systems. Here's an example. So the prenatal immunization status measure is currently an ECDS measure, and includes, and this is just showing the different code systems and example codes that are included in the measure. So you can see from this example, it includes CPT codes, right, that comes from an administrative record, but also SNOMED codes or CVX codes that can support standardization in the clinical record. And so to be able to efficiently measure quality and use data to drive improvement, it's essential that data is captured using those standard terminologies and in structured formats so that it can be also even mapped to these codes. And then, as we noted, there's also increasing data exchange and having better interoperability across systems. So some strategies to support data exchange, some of which we learned from those that are doing this work and shared that with us. One of which is incorporating data sharing into value-based payment arrangements, exchanging data between providers, payers, HIEs, and other entities, using the FHIR standard, which really supports the interoperability of health data, as well as implementing validation tools, such as NCQA's data aggregator validation program, that really helps to evolve the management and exchange of health data and make it more efficient and more efficient reporting for HEDIS. There's also some key facilitators and resources that can be helpful along the way. So one, there's regulations that can help spur that infrastructure change. There's many opportunities to align with those standards based on those regulations, some of which are focusing on health IT vendors, others for health plans and providers, such as CMS's final rule in response to the Cures Act that outlines those expectations for data exchange between payers and providers and payers, and of course for patients, all using FHIR. And then given some of these regulations and standards, there's also a lot of work by different groups led by the HL7 to develop resources and implementation guides, some of which we've noted here, such as the Da Vinci Project, which developed an implementation guide that helps to support exchange of data, particularly the data exchange for quality measures, DEQ-IG, which is enabling exchange of quality measures between payers and providers using FHIR, and also the payer data exchange PDEX implementation guide, which enables health plans to create a member's health history using FHIR clinical resources. And so we just wanted to share some of the resources that are available. As we know, many of you are working on your clinical data strategy and your strategy to move to FHIR. And lastly, we wanted to share some resources that can be helpful as that we provide, our ECDS webpage, as well as the Digital Quality Hub, where you can get some of these resources and that we've shared, as well as others to support your work as you move through this transition. So I'm actually going to hand it back over to Anna to take us into this next section before we get into the Q&A.
Thank you, Fern. That was great. There's a lot to take in with that presentation. So I have some follow-up questions for you. Does ECDS reporting use claims data?
Yes, so this is a common question we get, so that's why we want to emphasize the point. Administrative claims are an allowable data source for ECDS reporting. There are many measures that are still well represented by administrative data, and so that is still allowed. And so if you're an organization using administrative data to report, you can still use that data source for reporting as it transitions to ECDS. We just want to note that some measures um, do include concepts that may not be typically found in administrative claims. And so that's where incorporating those other data sources becomes particularly valuable when it's just not represented in the administrative source.
Thank you for that. And I know you explained this earlier on, but can you touch base again on what is the difference between ECDS, DQMs, and ECQMs?
Yes, this is also a common question we receive. So as I did say earlier in the beginning, the ECDS method that's really referring to the HEDIS. It's a HEDIS reporting guideline. We did spend a lot of time talking about what that is, what those differences are, but really it's intended to support the exchange of that information for reporting, for HEDIS reporting, as well as quality improvement. And then digital measures really is referring to that format, that that interoperable format, those specifications based upon the FHIR CQL standard. And as I noted, both the HEDIS measures that are available for ECDS and traditional are also available as digital content through our digital content services. ECQMs, those are CMS-defined digital measures that that derive or use EHR data. And so those are based on quality data model, or QDM, and also FHIR. So similar, but all different concepts.
Thank you. That is super helpful. Now, can you touch base on how is data for ECDS different from supplemental data?
Yes. So, as I noted, there may not be a difference at all in the sources themselves. So supplemental data is a term used for traditional methods, but those data sources that are referred to as supplemental data, or rather those data sources that are incorporated for ECDS, are just referred to as supplemental data for those other sources. So for example, data that's coming from an immunization exchange or immunization registry would just be considered supplemental for traditional methods. So there may not be any differences in those actual sources. It's just how the measures are calculated that differs.
Great. And one more question for you. Can data from medical records be used for ECDS reporting?
Yes. So another common question we get, but it's a great one. So yes, those information that may come from a medical record review can also be used for ECDS reporting. The goal, of course, is to get to a point where information is being shared in a more automated way, or our organizations are getting data electronically. But we know everyone isn't there yet. So we do allow data that's abstracted from the medical record to be used for reporting, as long as it's captured and stored and structured in a structured format and standard layouts. There's ability to use that for ECDS reporting.
Thank you so much. Now we have a few in the Q&A that we want to touch base on. So this one, I'm going to have one of our panelists answer. So Nico, what impact have you seen on measure performance in the switch from hybrid to ECDS?
Thanks, Anna. Yeah, so that's a great question. It is a bit tough. I think mainly because there's such nuance in the measures. So there is a variance in the performance amongst the measures, but generally we do see minimal difference between the reporting methods, the performance between those reporting methods. And we also do see some general increased performance using ECDS.
Thank you.
Thanks, Nico.
Now, this one is preparing for the future. So, do you have guidance for providers as part of the clinically integrated network who now report clinical data? What do they need to prepare for this transition?
Yeah, that's a great question. I would say certainly focusing on how you can get data in those structured formats, and identifying those opportunities for improvement to understand, well, I would say first, understanding the measures and the data elements within those measures, because that will lead to really identifying where those gaps may be, what standard terminologies do exist today that can be incorporated into your workflows. So I would say, that would be a key step, understanding the measures as they're defined in those different data elements. And then developing, and implementing the clinical data strategy towards FHIR, I think is key. Again, we can certainly follow up and, share, we share some of those resources and tools and guidelines, or guidance rather, that could really support those efforts. Those are available in the Digital Quality Hub, and we can certainly, it'll be in the slides that'll be available to you, but certainly we could follow up and share some of that with you.
Thanks. And we touched base on this one a little bit, but sort of want to go back to it. So I see that the medical record review is not included in ECDS. If we were extracting pseudo claim codes from the medical record, will it be accepted?
Great question. Yes. So the requirement for when pulling information from a medical record is that it can map, the information can, it can be mapped to an existing codes in the value set that have been defined for the measure. And so that's really the key. Can it be put into a structured format, in a standard layout? And also, can that information, does it have all the data elements that would meet the criteria for the measure, as well as meet the criteria for the value sets and codes that are also required to meet the measure?
Thank you for that. Are the 19 measures currently aligned with the CMS Universal Foundation measures?
That's a great question. There is alignment across, of course, HEDIS and the Universal Foundation, which we're very happy about. There are some of the measures that are in the ECDS, the list of ECDS measures that are in the Universal Foundation. We could certainly follow up with you exactly which ones, but we're working very closely with CMS to really work together in our shared goal to move the digital measurement. And so the Universal Foundation is certainly one of the areas where that have helped us in our prioritization of our work, as we work on identifying those measures as they transition. So we can certainly follow up with you with more specifics around which of those measures that are ECDS are also in the Universal Foundation.
Great. By when does NCQA expect to deprecate terms standard and non-standard supplemental data? Currently, there is not consistent understanding and application of these terms by plans and auditors. Migration to ECDS fixes this and has a hierarchy for SSOR, EHR, PHR, HIE case management. Administrative better align with recognizing EHR as authoritative source.
I love that. I love that question. That's a great question. One of the, in addition to these transitions, right, really transitioning the measures, introducing new measure concepts following the ECDS method, we're also evaluating the guidelines and better streamlining some of these rules, look at data collection rules and templates and so forth to better we provide more clarity and provide more, reduce some of the burden associated with reporting. And so we are looking at that, looking at some of the guidance around supplemental data, as well as some of the reporting designations as well, to see if there's any opportunity to create more of, make that more simplified or just more efficient as well. So we don't have any timelines or plans set just yet, but that is something we do see as important and a priority as we move through the transition to ECDS in digital measures is some of those guidelines that you noted in your question.
Great. Thank you so much. We will continue to go through the Q&As. And again, we encourage you to take the survey after this presentation. So that link will be popping up here. And it should go to your inbox as well with the email that you registered with. So if you have any questions, you can go to that. And again, we encourage you to go to the Digital Community Hub to our facts and answers regarding the ECDS questions. So thank you everybody for your time today. We hope you feel more familiar with ECDS after this. And again, stay tuned for more upcoming webinars from NCQA.
Thank you all.